is fever and cough, and then you can get some shortness of breath, difficulty breathing, and then that can progress to needing mechanical ventilation and intubation, so serious consequences in the hospital. The good thing about the coronavirus is that 80% of the population who do get infected will be just fine and will feel minor symptoms that can be taken care of at home. The difficulty that we're having with it is that 20% of the population who gets infected ends up in the hospital and needing some supportive care in terms of oxygenation or mechanical ventilation or things along those lines. The transmission rate of coronavirus 2, which SARS-CoV-2, which is the virus name, which leads to the disease COVID-19. The transmission rate is about 2 to 4, it's being estimated. So that means for every infected person, they can transmit it to 2 or 4 other people. And so compare that to the seasonal flu, for example, the transmission rate of the seasonal flu is 1.3. So for everyone who gets the flu, they can infect 1.3 other people. And then we talk about the incubation period, which is the time during which a person is infected, but they don't know that they have the infection. So at this time, the virus is replicating inside your body, but you don't really know that you're infected because you don't have any signs and symptoms. So the incubation period is a little bit long for this new coronavirus. It's estimated between 1 and 14 days, but the average is about 5 days. So that's 5 days that you're walking around with this infection, potentially infecting other people, but you don't even know. And so that's what is potentially making things a little bit difficult for the medical infrastructure. And so how we can get infected with coronavirus is by inhaling respiratory droplets. So if you're standing next to someone in close proximity for a while and they're talking or sneezing or coughing, you can inhale the droplets from being next to them. And so what makes that difficult is if they don't know they're infected and you don't know that they're sick, but they're standing next to you, you can get it from them. And another way that we can get infected potentially is by touching a surface where the virus is sitting. And we know it can last up to sometimes 3 to 4 hours, sometimes days. The studies aren't really accurate and more data is coming out. But in any case, if you touch a surface that the virus is on, and then we touch our face. So our face has a lot of portals of entry for viruses like your eyes, your nose, and your mouth. And so it's really important to continue to hand wash frequently or sanitize because that's a frequent way of how we get infections, not just the coronavirus, but other infections is by touching our face with virus on our hands. So that's why we're trying to promote hand washing a lot to try to prevent the transmission of the disease. And so now, like with the numbers I gave you, 80% of people will be fine if they get infected and 20% may need hospitalization. And the mortality rate is pretty low, estimated across the age spectrum to be 2 to 3%. But in our elderly population, so those over 80, the estimated mortality rate is kind of high, it's 15%. And so people are wondering, like, what's the big deal? Are we just overreacting? Is this mass hysteria? And so I think some of the followers of Celebrate Mercy might not be in the United States, but I'm going to talk about the United States experience for a minute because that's where I am. And so now we're starting to see a lot of cases in the United States, or a few cases, and the numbers are rising exponentially. But the big problem of not being able to contain or mitigate the spread of the disease is that if we have massive spread and fast, and 20% of all infected need to be going to the hospital for some sort of support, our healthcare infrastructure is not capable of handling those kinds of numbers. So we won't be able to take care of all of those patients. And so you might say to yourself, well, I'm 20, I'm 30, I'm not going to get severe disease, so this really isn't my problem. But actually, it's all of our problems, because even if you don't get a severe coronavirus infection, you may have another medical emergency during this time. And if you do, the hospital infrastructure, if we don't slow down the spread, hospital infrastructure across the country won't be able to handle other medical emergencies. So that's why it's really important that we stop the spread or flatten the curve. I'm sure you've heard those terms, stopping the spread or flattening the curve, or slowing down the spread at least, so that, you know, we know that it'll transmit, but if it transmits slowly across the country as opposed to fast, hopefully the medical infrastructure can catch up and take care of these people. But if it happens too fast, we won't be able to do that. So, so it's really important to just abide by the rules of public health, your public health departments, whatever they tell you about closing down schools and closing down restaurants and coffee places and all that stuff. This is why these things are being advocated. And just the last couple of points I want to address is that obviously, if you feel short of breath or having difficulty breathing, you really need to get yourself to a hospital and call 911 in the United States. And it's really important that when you call, that you tell them if you've been exposed or you know you've been exposed. And it's really important, if you're not feeling those symptoms, if you're feeling kind of mild symptoms, to call your physician first and not just show up in an office, because again, trying to mitigate or contain spread. If you do have the coronavirus, we don't want you to be spreading it to other people. So calling first is always the best option, and not just showing up either at your healthcare facility's office or a hospital. And I'm happy to take questions after this, but I hope this was like a good information session of why it's really important to take this really seriously.
Jazakallah khair, Dr. Nour. Thank you so much. I'm going to turn on my webcam real quick, inshallah. Assalamu alaikum, everyone. I hope you can see me and hear me. Let me know in the chat room if you can. Oh, there you go. Should be working now, inshallah. Can you guys see me now? Awesome. Jazakallah khair, Dr. Nour. Thank you for your talk, and just want to remind everyone that we do have a Q&A panel where you can submit questions, because we will have a Q&A session following all of the talks by our speakers, inshallah. My name is Tariq Al-Masidi. I'm the founding director of CelebrateMercy, the organization that is hosting this webinar today. We're really honored to have all of you all here. Unfortunately, it's not in the best of circumstances with this pandemic that has really taken over the world and our lives and our day-to-day lives and our normal lives. And we ask Allah to lift this fitna and this tribulation from the world, and to help those recover that have gotten this virus, inshallah. Before we move on, I just wanted to, you should be able to see the slides that I'm sharing here. I just wanted to mention what CelebrateMercy is. We are a nonprofit organization that teaches about the Prophet Muhammad's life and character through our words and actions to Muslims and friends of other faiths. And our whole objective is that we want to teach about the Prophet sallallahu alaihi wasallam, peace be upon him, so that, because you can't love someone that you don't know. You can't love someone that you don't know. So we try to do this through various means. I said words and actions. We try to teach about him through our words and actions. The words are things like these webinars or webcasts, events like traveling conferences. We have an Umrah trip that was just canceled because of this coronavirus, but we do an Umrah trip that goes from Jordan to Jerusalem to Mecca to Medina, and then through social media and campaigns. So that is what CelebrateMercy is, and I'm sure some of you are familiar with some of our past webinars, our past events, our past conferences. Alhamdulillah, they've reached so many people around the world. And we just heard from Dr. Nour, who is a specialist in infectious diseases, sharing with us what the coronavirus is, COVID-19. And we hope you all caught her talk, and if you have some questions for her, you can begin to submit your questions in the Q&A portion of the webinar. So begin to ask your questions. We are going to read through all the questions and select some questions for the Q&A session at the end of this webinar, inshallah. And before we move on to our next speaker, who is Dr. Abdul El-Sayed, we wanted to make a really big announcement that we have just launched a campaign on LaunchGood called Muslims Unite for Coronavirus Relief. And you can look at this if you go to launchgood.com/corona. This is a campaign that we are doing along with Penny Appeal USA and ICNYU, the Islamic Center at New York University, where Imam Khalid Latif is the chaplain and the imam. This is a new campaign where, even though we're sitting at home, let me actually X out, my WhatsApp is making some noise. Here we go. So even though we may be sitting at home, some of us not able to go to work, not able to even go outside to public places, we're gonna be home for a while. There is still a way that you can help and do something that is beneficial to humanity. There's a hadith of the Prophet ﷺ where he said, the most beloved of people to Allah, the most beloved of people to God are those who are most beneficial to people, those who benefit humanity the most. This is a campaign where every dollar that you donate can go to help people that are going to be really impacted by this pandemic, people that are not getting paychecks, people that are that maybe single parent households where they can't be at home with their kids. They have to pay for some type of childcare, even though their children are not going to school during this crisis. So this is a way you can donate to help families that are low-income families that will be very impacted by this. And also, if you go to this website, you can apply for financial grants. If you are someone that is suffering, you can apply for grants. Or if your masjid has a creative idea on how to help locally. For example, you can set up a group of people that would like to help the elderly getting their groceries. You know, we know that this virus impacts the elderly the most. So if you want to help form a network in your community to help the elderly with errands or with getting groceries or something like that, you have a creative project, this campaign can also fund a grant to your local mosque or your local organization to help, inshallah. I'd like to introduce now the CEO of Penny Appeal USA, who is going to introduce our next speaker, inshallah, Dr. Abdul El-Sayed. Penny Appeal is the organization we've partnered with on this campaign. So we're going to go ahead and turn on Osama's webcam and microphone, and he's going to then introduce our next webinar speaker, Dr. Abdul El-Sayed, and he may also mention something about this new LaunchGood campaign, inshallah.
Assalamu alaikum.
Alaikum assalam.
Thank you, Tariq, for the introduction. Before I have the pleasure and honor of introducing Dr. Abdul, I will just say a few words. Like Tariq said, this is a difficult moment for many, many families. And for many of us, social distancing is really a luxury that we can afford to work from home, to have our children with us at this time as schools are closed. But for too many families across the United States, of course, it's a luxury that people can't afford. There are drivers out there, people working in certain sectors, certain industries that force them to have to go to work, people who are earning freelancers, people who earn money on a paycheck to paycheck basis are really suffering and struggling because of the consequences of this corona outbreak. So we are honored to be working with CelebrateMercy and the Islamic Center at NYU to launch this campaign. It's launchgood.com/corona. And there you can do two things. You can contribute and help those families that are struggling, that are going to suffer as these weeks turn into months. But also you can actually, at the bottom of the page, apply for assistance. If you are somebody in need, someone who needs a little bit of assistance to get to the end of the month, we are there to help. So please do apply and encourage friends and family to apply. Now I have the pleasure of introducing someone who is a very close personal friend of mine, someone I've known for a long time. At the time I had more hair and he had less name recognition. But Dr. Abdul El-Sayed is a physician, he's an epidemiologist and a public health expert. Currently, Dr. Abdul is the chair of Southport, Michigan, a progressive political action committee, as well as a commentator on CNN. He is also the host of a fantastic podcast, which if you don't know about already, make sure you subscribe. The podcast is called America Dissected, a podcast by Crooked Media that cuts beyond the headlines to what matters in public health. Previously, Dr. Abdul was the former health commissioner for the city of Detroit, where he rebuilt the Detroit Health Department after it had been privatized during the city's bankruptcy. Before this, he was assistant professor of epidemiology at Columbia University in New York. He has authored over 100 peer-reviewed publications in epidemiology and public health and has served on local, state, and national public health boards, including the advisory board for the Assistant Secretary for Health People 2030 recommendations, as well as Michigan State Public Health Advisory Commission. He holds a PhD in public health from Oxford University, where he was a Rhodes Scholar, as well as a medical degree from Columbia University. So over to you, Dr. Abdul El-Sayed.
Assalamu alaikum wa rahmatullahi wa barakatuh. Jazakumullahu khair for that introduction, Usama. And I have to say, you're just as handsome now as you were back then. Barakallahu feek. I want to approach this situation that we find ourselves in, first and foremost, by asking Allah subhanahu wa ta'ala to alleviate the suffering that this is causing people. And we ask Allah subhanahu wa ta'ala to empower us in this country and abroad to take this on and to allow it to be a means to bring people together rather than tear them apart. And I want to approach this as a former health commissioner. My job in the city of Detroit was to run a health department. If I had been in that role right now, I would be in an emergency preparedness position where we would be overseeing the outbreak response in the city of Detroit, working with the state health department in Lansing, Michigan, and then working with the federal government and the CDC. And I want people to understand what we're facing. I thought Dr. Nour did an amazing job telling you about the biology of the disease and the epidemiology of the disease. But I want you to understand where we are right now and why we're taking such drastic measures, which are including, everything from shutting down schools to limiting mass transit and what it means for us right now. So epidemic response happens in 3 phases. The first phase is called anticipation and early detection. You literally want to see if and when there is a new disease, where it's breaking out, who it's affecting, the kind of constellation of symptoms that it's causing, and then you move into the next phase, which is called containment. And in containment, what you're trying to do is case by case identify who's getting it and who they're coming in contact with, and then working with those people to either isolate them or quarantine them so that they're not spreading it on. But the key here is to be able to identify every single person with the case, make sure that they get the care that they need, make sure that you've identified everybody they've touched, and then make sure that they're not spreading it to somebody else. The challenge, though, is that if you are unable to contain the disease, meaning you get to a point where you can't actually identify everybody who has the disease, then you're in what's called mitigation. And that's where we are right now with the coronavirus pandemic that we're facing. It's now affected over 1,500 people across this country, claimed over 50 lives, and it's spread to 49 out of 50 states. And what happens in mitigation is that you say, well, look, we can no longer identify every single person who has the case. So what we're going to do is we're going to put up blockades in society to reduce the transmission between people. And that means identifying every single place where people are coming in contact with each other, and then figuring out how to limit that. So that's why a number of states and a number of communities have shut down schools, because you have kids and teachers interacting with each other all day. A number of places are considering shutting down mass transit. A lot of workplaces have gone to work from home, if not canceled work entirely. the state of Ohio and Illinois just shut down all restaurants and eateries with the intent purpose of limiting the amount of admixture that people are having. And this is what we're calling social distancing. From a public health perspective, we call it mitigation. I want to speak to a couple of issues that specifically affect our Muslim community. Number one, obviously, our faith is practiced in community. And the most stark example of that is Salat al-Jum'ah every Friday. And a number of masajid and even state imams councils have all but canceled Jum'ah prayers. There's a precedent for this in our tradition that is thought through so many of the social trials and tribulations that people face as a community. It's really, really critical that we pay attention to what our imams and our leaders are saying. In our faith, there is a real precedent for centering the responsibility to save a life. And if something that we're doing could hurt people, then we need to stop doing it. And that's why imams have come out and said, well, we're not going to observe Salat al-Jum'ah in a community format, pray in your homes instead. Similarly, I hear a lot of folks say, well, you know, Allah subhanahu wa ta'ala will protect us. And maybe it's okay for us to go to the masjid. After all, we're praying to Allah subhanahu wa ta'ala and this is in his hands. That is true. But in our faith, we know that you make dua and you tie your camel. And right now, tying your camel means reducing the amount of social admixture that we're doing, which means staying away from community spaces like the masajid in this time. The other point I want to make is that oftentimes we are taught to think about health as something we do as individuals, but public health is about what we do as a collective. As Dr. Nour talked about, the risk of this disease is substantially higher in older people. And I just want to explain what I mean by that. The mortality rate in somebody who's in their 30s and relatively healthy is about 0.2%, 0.2%. And 0.2% is about as bad as a flu. And you know, we all do things to protect ourselves from the flu, but it's not something we call home about. So why are we so worried about coronavirus? Well, because if you go over the age of 70, the risk of death is greater than 10%. That's 1 in 10. Now, I want you to think about somebody who you know who's 70. Now, think about all the people you know who are 70, and I want you to think about lining up every single one of them, and 1 out of the 10 could die if they contract this disease. That's really, really serious. So you might ask, well, if I'm young and healthy, what do I have to do with them? Well, it may be that the greatest risk of this disease for you is not that you get the disease and you bow down. If you get the disease and then somebody else gets the disease through you and you become a means by which somebody else got the disease and potentially passed. Our responsibility right now is to protect the most vulnerable in our community. Those are our seniors. Those are people with underlying chronic disease. And every step we take to make sure we don't get the disease is also making sure that we don't become a nidus that communicates the disease to somebody else. And that's absolutely critical. One of the important things about the disease, though, is also that just because there are more younger people, young people have really bad cases too. And it's not that 0.2% is still potential for death. And so we have to make sure that we are also protecting ourselves and protecting those around us in our community. I also want to just prepare everybody to understand that this is not something that's just going to last a couple of weekends. It's not just going to last a week. My estimates, and based on all the literature that I've read and the experts that I've spoken to, is that we're going to be getting bad news for probably the next 2 months before we start hearing good news. It's going to get worse. Think about it as being on the outside of a very large storm right now, and the storm is coming to us, but it hasn't hit us yet, and we're not through the eye. And so, you know, really do batten down the hatches and be ready to persist in very altered circumstances where you're social distancing and you're practicing mitigation efforts, and your kids aren't going to school and you're not going to work, and you know, you're only really leaving the house for the needs, not the wants. This is going to last for a while, and so I want folks to be ready for that. And then lastly, just remember that that one thing about the most vulnerable people in your life, our instinct is to want to go to them, but that may be part of the problem. And so I'm telling folks right now that the best advice is don't visit your elder loved ones, call them. And if they need something, be there for them, but maybe that you pick up your groceries, you leave them outside, you talk to them through the door, through the window, you go home, and they go and open the doors and pick up those groceries. And then lastly, just because it hasn't been said yet, I think it's critical to understand that there are things that you need to do to keep yourself healthy and others healthy. Number one, I know you're seeing masks all over the place. Please don't buy masks. There aren't enough of them. Leave them for the medical professionals who are on front line. Number two, the most important thing that you can possibly do to protect yourself and therefore protect others is to wash your hands. That doesn't mean just rinsing your hands, right? That means 20 seconds with warm, soapy water and making sure to get all of the crevices of your hands. Wash your thumbs, make sure that you're working the backs of your hands, make sure that you're washing your fingernails, wash your hands consistently. Alcohol-based hand sanitizers are also extremely effective, so have those on hand. If you're going to go out, make sure that you've got Clorox wipes on you and disinfect everything that you touched. I was at Costco earlier today buying some supplies for the house, and I brought some Clorox wipes and wiped down the cart before I touched it, and then wiped my hands off and washed them with hand sanitizer after I got back in the car. I know these are little things, but they're really critically important. Three, please do avoid public spaces. And that, unless your job requires you to fly, I would really, really reconsider whether or not you're going to do that. If you're in any sort of mass transit situation, stay away from crowded spaces. Make sure that you are not touching things that other people would have touched. And if you are, washing your hands. And then lastly, as always in these circumstances, ask Allah subhanahu wa ta'ala to keep you healthy and your family healthy, and make sure that you are calling and checking in on the people who are most vulnerable. That's what I've got. I look forward to, inshallah, any questions that are available at the end of our webinar. And I do want to say Jazakumullah khair to Tariq and the team at Celebrate Mercy, as well as Usama and his team at Penny Appeal. You all are springing into action, and you're really demonstrating our responsibility as Muslims to care for our broader community, because we know that our responsibilities in these moments have everything to do with being good neighbors and being responsible within our community, and demonstrating what it means to be engaged and involved in what our community is engaged and involved in.
Jazakallah khair. Thank you so much, Dr. Abdul. Let me turn on my webcam here. Thank you so much to Dr. Abdul El-Sayed for sharing those insightful words and the advice. Inshallah, he'll be joining us later in the webinar during the Q&A portion. Just a quick reminder to everyone. Let me make sure you can see my slides. Can you just let me know in the chat room that you guys are seeing the slide here that says Dr. Abdul El-Sayed? Okay, good. Because I put it on full screen now. What I wanted to tell everyone now is that we have a chat room here where people can chat with each other in this webinar. MashaAllah, we have over 500 computers that are connected to this webinar right now. 500 computers means that we have so many families, so many couples that are also watching. So we could even be up to a couple of thousand people watching all together. I just wanted to ask everyone to take a moment in the chat room and let us know where you are joining this webinar from. Let us know the city, state, country, where you're joining from. Dallas, Indiana, Bensalem, Pennsylvania, Chicago, London, Virginia, Maryland, Massachusetts, whoa, this is going fast, Michigan, Texas, Fremont, California, Dearborn, Michigan, again, California. Wow, this is, whoa, I can't even, okay, Cairo, I saw Cairo, Great Falls, Virginia, Utah. This is too fast to even read. Toronto, okay, New Jersey, Colorado, Michigan again, New Jersey, Ottawa, Australia, nice. Princeton, New Jersey, Austin, Texas, Dublin, California, Houston, Texas, Portland, Cleveland, New Jersey rocks. Someone said Knoxville, Tennessee, my hometown, mashallah. Shout out to Knoxville and my family out there. Michigan, Vancouver. Any other international besides the United States? Anyone joining? No, someone said Mars, that can't be, okay, Kuwait. Mexico City, mashallah. Dubai, Qatar. Okay, great, great. Arizona, Manchester. Okay, great, mashallah. We have people joining from all over. Nigeria, okay, great. So we're definitely on joining from Hong Kong, mashallah, Cincinnati. Okay, good. So it looks like we have most continents covered here, mashallah. That's really excellent news. Syria, wow, mashallah, that's amazing. Antarctica, I'm not sure if I believe that, but maybe. Okay, so let's go ahead, inshallah, to our next speaker. I am going to ask for Subhan to introduce our next speaker, Dr. Ingrid Mattson. She will be our next speaker, inshallah.
Assalamu alaikum, everyone. So I'd like to introduce Dr. Ingrid Mattson. Dr. Ingrid Mattson is the London and Windsor Community Chair in Islamic Studies at Huron University College at Western University in Canada. And from 1998 to 2012, she was Professor of Islamic Studies at Hartford Seminary in Connecticut, where she developed and directed the first accredited graduate program for Muslim chaplains in America. And she served as the director of the McDonald Center for the Study of Islam and Christian-Muslim Relations. From 2001 to 2010, Dr. Mattson served as vice president and then as president of the Islamic Society of North America in the USA. And she was the first woman to ever serve in this position, in either position. Her writings, both academic and public, focus primarily on Quran interpretation and Islamic theological ethics and interfaith relations. Her book, The Story of the Quran, is an academic bestseller and was chosen by the U.S. National Endowment for the Humanities for Inclusion in its Bridging Cultures program. So without further ado, I'd like to bring Dr. Ingrid Mattson online. Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum assalam wa rahmatullahi wa barakatuh. Assalamu alaikum, everyone. I'm really happy to have this opportunity to connect with you. Alhamdulillah. It's a great reminder of how connected we are. I mean, alhamdulillah, we don't need a disaster to, as Muslims, to realize that we are connected. We feel that every day with each other, alhamdulillah, and I think it's one of the reasons why I feel very proud of so many in our Muslim community who were able to immediately understand that what we're facing these days is about all of us together as not only as Muslim communities, but as a human community. We hear those lessons, we learn about this every day as Muslims, and alhamdulillah, because of that, we are able to respond in a crisis, even though there are many unknowns, still we have the principles. And this is one thing I want to really emphasize, is that all of us should have confidence that we have the ability to respond, inshallah, at least to meet our moral and ethical responsibility in this situation. It doesn't mean we're in control. Indeed, we know, and the grounding of our confidence is that we know that Allah subhanahu wa ta'ala is in control, that Allah is the creator of all things, even this virus, and that nothing happens without Allah's command. One of our pillars of faith is to believe in qadr, the good and the bad of it. And that means that while we see there are many hardships and sufferings, and it is our responsibility to respond to those things, still we believe that Allah subhanahu wa ta'ala will bring us what we need so that at least we can each individually and collectively do the best we can to fulfill our responsibilities. And that's all that we are asked to do. So we believe in Allah, and we believe that all of this creation is responding to Allah's command. And now it is our turn to really understand what is our role in all of this. Alhamdulillah, we have the teachings of the Prophet Muhammad sallallahu alaihi wasallam, and all of those who strove to follow in his blessed footsteps through the generations to guide us through this situation. We know through the many stories that we have heard of Muslims in past ages, including the first generation, that they went through numerous collective hardships, that they were tested by really difficult situations. And through the way they responded to them, we know what principles should guide us during this time. We know that at the very beginning of Islam, that Muslims were really challenged with persecution. And when there was an extraordinary challenge, they took extraordinary measures to respond. So for example, just the fact of the Muhajirin being hosted by the Ansar, sharing completely equally everything they had with the Muhajirin during an extraordinary time. We know that during the time of Sayyidina Umar ibn al-Khattab, may Allah be pleased with him, the second Khalifa to follow the Prophet Muhammad sallallahu, that during his lifetime, there was a year where there was a terrible drought. It was called the Year of Ashes. And it was such a terrible drought that hundreds and then thousands of the Bedouin poured into Medina because all of the water had dried up, their camels died. That was the source of their food and nutrition, and they were dying. And Sayyidina Umar ibn al-Khattab took extraordinary measures to respond to that he called upon all of the Muslims everywhere to send food, that he himself took a voluntary vow where he would abstain from butter, meat, and milk until the drought ended. So these are things that are halal, that are lawful, but he abstained from them in solidarity with those who were suffering and to share any little bit that he had with those who were suffering. And he said that if this drought had lasted a year, that he would have spent everything in the treasury, even up to the last dinar, in order to feed people, because that was the obligation. We know that in our teachings that urgent needs take priority over everything else. Urgent needs are those things that are required to sustain life. And this is why in this situation, we are being asked, as you've heard from Dr. Akhras and from the public health perspective, that we are being asked to give up certain things, even our collective prayers, in order to really meet the urgent needs of people. That means to keep them alive. And that is something that again and again we learn about in our tradition. So it is not piety in an event that is really extraordinary, an extraordinary disruption, to respond to it as if nothing happens. That's not piety, that's not taqwa. In fact, what we know is that extraordinary circumstances require extraordinary responses. SubhanAllah, among the many major principles, the qawaid of Islam, or the maxims or legal maxims or canons, are those that truly apply to this situation, so that hardship must be alleviated and that harm should be removed. Ad-darar yuzal, so harm must be removed and that hardship should be alleviated. Al-usr yajib at-taysir. What does that mean? It means that we apply those principles to all that we do, so that if there is harm by our social interaction, by meeting with other people, by praying together, that then we avoid these things in order to stop the harm from persisting. We know that hardship should be alleviated, so that if people are suffering, and we know they are because of the situation, whether the impact to their employment and their income, if they are isolated and they need support, that it is our responsibility to go and chip in a rational and helpful way, according to the experts who understand this situation. And so these are two of the 5 major qawaid or legal maxims in Islam, and they completely apply to this situation. I want to also bring in one other of the 5 major maxims, which is that certainty will not be removed by doubt. And this is important in this situation because this is an epistemological principle, meaning how we know things. And I bring this in because it really speaks to the importance of listening to experts, not buying into conspiracy theories or bogus treatments or people speculating about all different kinds of things. That we rely in Islam on those who have knowledge of a situation, and that just because someone comes up with a possible theory, that possibility does not give us any knowledge. Possibility is, we are extremely imaginative beings, and we can think of all sorts of scenarios. So we don't rely on those imaginative scenarios or speculation in order to make decisions. We rely on knowledge, on certainty, or the preponderance of evidence in every situation. And so it's really important to listen to those who have knowledge of what is happening in this situation. I know that there are, you know, when something shocking or new first happens, it is really easy as a kind of protective mechanism to fall into denial or to minimize that situation. This is a very common human response. So we have to get over that and really come to terms with the change that is going to be necessary in our lives. Now, alhamdulillah, we also have the blessing of our practice of fasting the month of Ramadan. So we already have this experience every year annually where we have a whole month of living in a way that is different than other times of the year, where we disrupt our normal pattern. And that, in some ways, I hope, inshallah, will help have prepared us as Muslims for dealing with a situation that is very different. Now, of course, it's not the same. There are more and really unexpected kinds of disruption, but we know that sometimes we can experience tremendous benefits from these disruptions. So while we are changing our lives out of a sense of ethical obligation in order to prevent harms and to promote benefits for people, to really make sure that those who are vulnerable have the most possibility of having their needs met, that at the same time we can look to this change in our lives as an opportunity to reflect on how we normally do things, to think about how perhaps as a society we could have been better prepared, to try to, rather than just being resentful about how our lives have changed, look to the opportunities that are presented to us by perhaps having more time with people in our family, having more time for reflection, try to benefit from that time, because all of those things are possible. And I really hope that when we look back at this situation a year from now, we're going to feel somewhat satisfied that in the end we responded in a way that was ethical, where we, while we may have had some deprivations, we followed the teaching of the Prophet Muhammad sallallahu alaihi wasallam, that when you see someone who has more, look to someone who has less. So for many of us, while we may be sacrificing certain things or finding certain situations challenging, we will always use that as the opportunity to see who is struggling even more than we are ourselves. Finally, to end, I also want to just say a word about illness and about how Muslims in the past dealt with epidemics or pandemics, because there were many times throughout the generations where plagues came and ravaged communities, where there were contagious diseases within the communities. And there is a lot of really interesting scholarship on this, looking at comparing the way that different faith communities responded to these things. Now, in many faith communities, whenever there was a contagious illness or a pandemic, it was the opportunity for people to engage in blaming, to put stigma on certain kinds of people. Very often they were people who were from a different ethnic or cultural group, or they looked to people from a different religion as the cause of these illnesses. So for example, in medieval Europe, according to the scholarship of Michael Doles, that very often whenever the plague broke out, that you found Europeans who would go and engage in massive violence against Jewish communities. They would stigmatize and commit violence against many people in the community who were different than them because they blamed them as the cause of this illness. And alhamdulillah, we never had this in Islamic history ever. That Muslims understood that everything comes from Allah subhanahu wa ta'ala, that sin and health or sin and illness are not necessarily causal of each other. So you can have someone who is a terrible sinner who is very healthy, and you can have someone who is very righteous and who is terribly sick. So we don't make those kind of associations. So it's really important, especially if this pandemic continues to create a lot of hardship in communities, that this kind of social psychological phenomenon does not take any kind of root itself at all in our community as Muslims. We know that it is, we do not make these kind of connections, and we should make sure that we stand on principle and see this as an opportunity for all of humanity to be united, and we can demonstrate exemplary behavior in that regard. I ask Allah subhanahu wa ta'ala to guide us and protect us in these days. Thank you for your attention. Assalamu alaikum.
Wa alaikum assalam wa rahmatullah. Thank you so much to Dr. Ingrid Mattson for your talk and for your advice and your insights and wisdom. Jazakumullah khair. Inshallah, she will be joining us at the end of the webinar for the Q&A portion. And just a reminder that on your Zoom webinar panel, you see an icon that says Q&A. That is where you should be submitting your questions. We are getting a lot of great questions. We are compiling those questions and choosing some that we will ask our speakers at the end of the webinar, inshallah. Just a reminder as well that if you look on Celebrate Mercy's Instagram, our Twitter, our Facebook, you'll see that we have posted this flyer. So you can download this flyer, you can text it to your friends. If they don't know about the webinar, they can still join and catch our upcoming speakers as well. We also do have a hashtag for this webinar. That hashtag is CoronaCM, CoronaCM. So if you'd like, if you want to post any of some of the quotes that you have heard from our teachers today, then you can use that hashtag. You can also mention Celebrate Mercy. Our Twitter handle is CelebrateMercy. So we may even share some of your tweets later in the webinar as well. Inshallah, we can take some screenshots of some of these tweets that use the hashtag and share them on the webinar. So let me move on to our next portion here. Another reminder is of the new Launch Good campaign that we talked about earlier, launchgood.com/corona. One thing I want to mention about this campaign is if you go to this campaign page, you will see there's a section called Community Partners. That is where your masjid, your youth group, your Muslim Student Association, your organization can sign up as a community partner on this campaign, which means that you have shared it among your email list on your social media. SubhanAllah, Imam Khalid Latif was on MSNBC on national TV a couple of hours ago, and he talked about this campaign on national television. And within minutes, we got an email from an organization called Coalition of Progressive Hindus. Believe it or not, Coalition of Progressive Hindus. And they shared this campaign, this flyer that you see right now, they shared this flyer on their page, and they encouraged people to participate and to donate to it. It's called Coalition of Progressive Hindus, and they asked to be a community partner. So this was before any masjid has even messaged us about it. So subhanAllah, inshallah, this is going to be an interfaith effort to raise funds for people that need it, who are most impacted by this pandemic, and the money can also help organizations that are doing great projects locally on the ground to help relieve some of the financial burdens and the difficulties that people are facing as a result of this pandemic. We have a few sponsors I just want to mention quickly in between speakers here. One is Penny Appeal that was presenting earlier. We have partnered with them on that Launch Good campaign. Launch Good is also one of our sponsors. It's a crowdfunding site that many Muslims use to raise funds for their masjid, for their organization, for their cause. Celebrate Mercy has always used Launch Good as the crowdfunding platform for fundraisers. Alhamdulillah, you can visit launchgood.com. They just reached a milestone of raising a total of $100 million. Launch Good is about 10 years old, and they have raised already $100 million on all these different crowdfunding pages through their platform, alhamdulillah. And then we have, lastly here, before I go on to Dr. Rania Awaad, we have the Rahma Foundation. And the Rahma Foundation is a 501c3 nonprofit organization that is committed to teaching Muslim women and girls their obligatory Islamic knowledge via local and online programs taught by qualified female teachers and specifically designed for Muslim women. Programs include halaqas for girls and women, live workshops online and in person, mentorship programs. The Rahma Foundation strives to make our programs free of cost or with very minimal fees so that quality Islamic knowledge can be accessible to all women. We rely on your generous contributions, and you can visit therahmafoundation.org to learn more, and we thank them for being a sponsor of this webinar. And without any further delay, I'm going to ask Subhan, one of our Celebrate Mercy team members, our program manager, Subhan Vahora, to introduce our next speaker, Dr. Rania Awaad.
Thank you, Tariq. So I'd like to introduce Dr. Rania Awaad and give you a brief bio about Dr. Rania. Dr. Rania is a clinical associate professor of psychiatry at the Stanford University School of Medicine. Her research and clinical work is focused on the mental health needs of Muslims, mashallah. And through her outreach work at Stanford, she is also the clinical director of the San Francisco Bay Area branches of the Khalil Center, a spiritual wellness center that pioneered the application of traditional Islamic spiritual healing to modern clinical psychology. And she has been the recipient of several awards and grants for her work. Prior to studying medicine, she pursued classical Islamic studies in Damascus, Syria, and holds certifications in Quran, Islamic law, and other branches of the Islamic sciences. Dr. Awaad has also served as the first female professor of Islamic law at Zaytuna College, a Muslim liberal arts college in Berkeley, California, where she taught courses on Shafi'i fiqh and women's fiqh and Quranic sciences for nearly a decade. Dr. Awaad is a nationally recognized speaker, award-winning teacher, researcher, and author in both the Islamic and medical sciences. And today we are honored to have Dr. Rania join us on this webinar.
Assalamu alaikum wa rahmatullahi wa barakatuhu. Thank you so much, Brother Subhan. Thank you, Tariq, and for the Celebrate Mercy team. Bismillah ar-Rahman ar-Rahim. Wa sallallahu ala Sayyidina Muhammad wa ala alihi wa sahbihi wa sallam ajma'in. Sisters and brothers, Today is March 15th of 2020, and exactly 1 year ago, on March 15th of 2019, we heard the terrible news of our sisters and brothers being massacred in New Zealand at the masjid, their safe haven and space, praying the Jum'ah prayer. Just a couple of days ago in Jum'ah, many of you, like myself, were prevented from going to the Jum'ah prayer because of the coronavirus outbreak, and for good reason. They're two unrelated events, but they are both events that have taken away that sense of safety from us in the world and have caused quite a bit of feelings of anxiety and confusion, and honestly, sadness even as well, because many of us are wondering about what's going to happen for the Tarawih prayers in Ramadan coming up. For some, their Umrah trips have been canceled, like Celebrate Mercy's trip, unfortunately, but inshallah, Allah will bring it back. And some are looking to Hajj and wondering if they're going to be able to do their pilgrimage. We're also heartbroken seeing pictures coming out of the Haram al-Sharif being empty and devoid of people, a very strange and kind of surreal picture that we haven't seen in our lifetimes. And we're feeling these levels of emotion, of anxiety, and we're wondering, is this normal or should we be doing something about it? Well, I'm here to tell you that anxiety to a certain extent is actually something that is healthy. It is an emotion that Allah subhanahu wa ta'ala created as He created all other emotions, right? Anger and fear and sadness and happiness and depression and so on. And a certain amount of anxiety actually helps us get into shape to plan meals and to buy our essentials and to figure out activities with our children as we're quarantined with them and figure out how to work from home. But there's also a certain level of panic and anxiety that goes beyond that, which we actually need to work on modulating. And I hope to talk with you about it a little bit today, inshallah. And for those who are wondering, is this actually a normal feeling? Very much so, because it's understandable. There is a fear of the unknown. We don't really know exactly what's going to happen with this virus. For many, there are multiple options, ourselves, but also children and also elderly. And for many of us, we may also have family members who are ill or immunocompromised, and we're particularly worried and concerned about this virus. And on a communal level, we have to remember that we're also dealing with, as a Muslim community, dealing with collective and cumulative trauma over time. You know, this quarter at Stanford, I taught a class called The Psychology of Xenophobia to our students, and we focus on the topic of Islamophobia and its effect on mental health of our Muslim community. And as it turns out, the two are very much related and connected, and our community is definitely feeling a higher level of anxiety than most because there are so many. And I started with the talk of New Zealand, just thinking about how, in even just 1 year alone, there have been so many accounts of Islamophobia and difficult pieces of news before we even get to coronavirus. And to think about how, even though these are separate events, there's so many of them and we don't have time to heal in between them, that they honestly feel like they're somehow connected. And our symptoms are intensified and our recovery is prolonged. And for that reason, I want to share with you what I hope to be 5 practical coping tips to deal with the anxiety and the fear that we're all feeling today. Number 1 is to talk and listen. And what I mean by that is to talk through your feelings and emotions with those whom you trust. This is really important and sounds simple, but it's really important not to keep it all bottled up, especially for those who are in the role of caretakers. To kind of hold it all in and to think you're going to be strong for everyone else only means that you're going to be overwhelmed because the situation is overwhelming. But when you talk with others that you trust, there is a sense of vulnerability where you're able to share how you're doing, and then they open up and share how they're doing, and you realize you're not alone in this. It's really important to do that kind of talking. And the flip side of talking is listening. And listening means actually reaching out and hearing those who are most impacted and how they're doing. Our elders, for example, they've been hearing that they are more susceptible than anyone else to be affected by COVID-19 and have a higher level of mortality rate than the rest of younger people. And so get a pulse on how the elders are feeling, ask them, help them speak through that anxiety. Same with the children, to come down to their level and remember what we do, we role model to our children. So if we're feeling really anxious, so are they. And so to get down to their level and see how they're actually doing, and to remember that everybody deals with trauma and difficulty in the same way. So be flexible. Don't judge, don't assume, don't shame, right? And give support to one another. Number 2 on this list is to moderate our news intake. And I know I'm asking for the impossible, considering that we're all quarantined and kind of plugged into our electronics and are checking the news that's evolving so quickly, not just day by day, but literally hour by hour. And I'm asking you to consider the alternatives of what it means to be quarantined in this way, what it means to sit face to face with your family members and actually spend quality time. And there's so many different ways to do this, whether we consider, really sharing with adults and children alike, especially the lessons that we're getting out of this, the silver lining, right? Whether you consider and talk to them about, there's so much talk on hand washing, and you talk about how Islam has the lessons on tahara. We are people of purification. We wash our hands and our faces so many times in a day in our wudu. We wash in istinja and ghusl right after the bathroom and in showering and before and after eating. And in so many different circumstances, we are people of purification. And whether you come at it from a seerah perspective and talk about the life of the Prophet ﷺ and how he dealt with this kind of illness, specifically him personally, thinking about his own parents who both passed away in different years because of the fever of Yathrib, of Medina, that cost them both their lives. And it was a contagious fever, potentially a virus, and how that impacted him on a very personal level, sallallahu alayhi wasallam. Or whether you come at this from a discussion of fiqh, talking about, for example, the rules Allah has put in place in terms of halal and haram meat consumption. I mean, this illness is coming through a zoonotic carrier, and our discussion as human beings and how we deal with the animal kingdom and animal cruelty and the rules Allah has put in place of what we can and cannot do and cannot consume. For example, there's also the discussion, so many people were watching these clips of mu'adhins giving the adhan and saying in the adhan, pray in your homes, and we're surprised by this. But these are rules of fiqh that are found in our chapters of prayer, of salah, and inclement weather or on difficult circumstances like this, asking us to pray at home and break the jama'ah in times like this. These are wonderful discussions to really engage our family members with. This is also the time to pull out and dust off our puzzles and our Legos and anything that we're able to kind of sit with our children face to face. And remember, adults and children alike respond better to human connection rather than electronics, even if they tell you otherwise. Even the teens that say, no, I want to play the video game. If you avail yourself, they will respond on a much better level. And spiritually, which brings me to the next point, number 3, which is to take time. We're given more time in this particular circumstance, and to take care of yourself, especially the caretakers, to take care of yourself and take breaks. As in to say, so many of us have never really worked from home, and we're not sure how to juggle the schedules of working and dealing with children, for example, that are all at home at once. But take breaks and take care of your body, eat healthy, and sleep well. This is not the time to spend it all on binge watching, right? Get good sleep and make sure also that you're not escaping the anxiety by using substances. And spiritually, I want to say, and I know some of our other speakers will go into more depth, but I do want to make one important point, because in the field of psychology, we often prescribe meditation. And I want to tell you that in our Sunnah of Islam, there is our own sense of contemplative, meditative practices that are indigenous to our Islam. And they are very much the concepts of like i'tikaf, right? Spiritual seclusion. And especially for the woman on this, I want to tell you, it is not limited to the masjid or to men. I'tikaf is something you can do at home. And if you're curious about this, certainly the slide before on the Rahmah Foundation, you can find my talk specifically to the i'tikaf of women and how to do this at home. But men and women alike, taking some time away, doing a seclusion away from everyone else in the family, even for just minutes and moments of the day, and doing our meditative practices of tafakkur and tadakkur and tadabbur, and I'll translate. Those are tadakkur is doing dhikr and remembrance of Allah subhanahu wa ta'ala. Tadabbur is a contemplation, thinking about how this tiny little invisible virus has brought us all to our knees and really unsure what to do, not just us, but the world around us as well. And one of my spiritual teachers would say, it's like a pressure cooker. Every pressure cooker has a valve that allows the steam to be released. And she would call that valve i'tikaf. And she would say that spiritual seclusion. And if we don't have it built into our days, we will explode the way a pressure cooker will explode without that valve. And so to really take that time, those moments of the day, and to steal them away and really, kind of center back in order to be able to help everyone else around you. And I'll share very quickly a couple of my own spiritual aphorisms that I hold dearly onto that really help in moments like this. Allah subhanahu wa ta'ala says in Surah Al-Baqarah, لا يكلف الله نفسا إلا وسعها, that Allah will not burden a soul more than it can bear. And also says, قل لن يصيبنا إلا ما كتب الله لنا, that nothing will happen to us except what Allah has ordained for us. And to sit kind of in that space and to really think through those things actually helps bring the anxiety down. And so does number 4, which is to take action. And CelebrateMercy, Penny Appeal, and the others, as you've heard, starting this process of taking action. They are the sabiqun, the first on the train doing this, inshallah. And a reminder that this actually helps bring anxiety down as well, to creatively think about how to help the most vulnerable in our communities. Doing packages and care packages and grocery shopping for those in meal trains for elderly and immunocompromised, the homeless, those living from paycheck to paycheck, to really help us, and also helps our children feel a sense of control when they can actually help us with the planning. And anybody who'd like to know more information on how to talk to children in times of anxiety like this, there's an article that I'd written on Muslim Matters last year at the time of the New Zealand shootings that goes in that in more depth, inshallah. And lastly, my last point on this is that all the 4 points that preceded will help many people with their anxiety. But there are certainly a group of people that this list will not be enough, that their anxiety and panic may be too high. Perhaps there's also an underlying condition already in place of depression or anxiety and such. And I really urge you to seek out professional mental health help in circumstances like this. I remind you that, and myself, that there are so many mental health professionals out there that because of the virus are now migrating all of their services to online. So it's much more accessible than before. I'm sitting here in the Khalil Center in our Bay Area office headquarters, and this is a Muslim counseling center that integrates Islamic spirituality into the professional counseling. And now we've migrated most of our sessions onto online. So it's much more available. So organizations like this as well. And there's also going to be tutorials for how to deal with anxiety that will go in much more depth than the 5 points that I've given here above. So I hope you'll make use of them. And lastly, to say that even though these times are tough, Allah subhanahu wa ta'ala has made us tougher. And to remember that whatever He sent our way, He has the power to take it away. And if Allah subhanahu wa ta'ala brought us to this, He will inshallah bring us through this. Ya Rabbil Alameen. Walhamdulillah. وصلى الله على سيدنا محمد وعلى آله وصحبه وسلم. السلام عليكم ورحمة الله وبركاته.
Alaikum assalam wa rahmatullah. Thank you so much, Dr. Rania. And Subhan is now going to introduce our next speaker, inshallah, Imam Omar Suleiman.
Thank you, Tariq. So I would like to introduce Imam Omar Suleiman. He really needs no introduction, and inshallah in like 1 minute I can give you a brief description of what Imam Omar Suleiman does. Imam Omar Suleiman is the founder and president of the Yaqeen Institute for Islamic Research and an adjunct professor of Islamic Studies in the Graduate Liberal Studies program at SMU, Southern Methodist University. He's also the resident scholar at Valley Range Islamic Center and the co-chair of Faith Forward Dallas at Thanksgiving Square. He holds a bachelor's in accounting, a bachelor's in Islamic law, a master's in Islamic finance, and a master's in political history. And he is currently pursuing a PhD in Islamic thought and civilization from the International Islamic University of Malaysia. And so without further ado, I'd like to have Dr. Imam Omar Suleiman join us on the webinar.
Assalamu alaikum wa rahmatullahi wa barakatuh. I hope you all can see me, inshallah ta'ala. All right. Bismillah ar-Rahman ar-Rahim. Alhamdulillahi Rabbil Alameen. Wa la illa ala al-zalimin. Wa al-aqibatu lil-muttaqeen. Allahumma salli wa sallim wa barik ala abdika wa rasulika Muhammadin sallallahu alayhi wa sallam. وعلى آله وصحبه وسلم تسليما كثيرا. I first want to begin by just saying how much I've enjoyed thus far the reflections. SubhanAllah, may Allah subhanahu wa ta'ala bless all of my co-panelists, Dr. Ingrid Mattson, Dr. Rania Awaad, Dr. Nour, and of course Imam Zaid, Dr. Abdul El-Sayed, Abdul El-Sayed, and of course to come inshallah to Imam Zaid and so on. But just I've really enjoyed thus far these reflections. I also want to thank them for mentioning, Dr. Ryan just mentioned the Christchurch victims. SubhanAllah, I mean, I think it's important for us to just take a moment and think how difficult it must be for them to be observing now the 1-year anniversary of these shootings in isolation as well. They're not able to gather, in these moments. So we ask Allah to comfort the families that have been left behind, to accept their loved ones as shuhada, and to join them all together in the station of shahada, and to be as near to the Prophet sallallahu alaihi wasallam Jannatul Firdaus as possible, and to not deprive us of that reward. Allahumma ameen. I want to pick up where Dr. Rania spoke about this idea of doing good as a means of warding off anxiety. There's really a beautiful saying from Imam Al-Qayyim rahimahullah ta'ala about good deeds warding off anxiety and illness. Some of you might have attended the webinar that we did with the Yaqeen Institute for Islamic Research yesterday, and we actually just put out an infographic. So if you go to yaqeeninstitute.org, you'll see an infographic there that our team put together, alhamdulillah, and you'll find this quote from Ibn al-Qayyim rahimahullah and this idea of doing good. And that's really what I want to speak about, inshallah ta'ala, with the few minutes that I have in terms of doing good while we're in this period. The benefits of al-hasanat. The Prophet ﷺ connected a sense of anxiety or a sense of urgency to good. So for example, when the Prophet ﷺ said that the day of judgment, if the day of judgment is upon you, whoever amongst you can plant something, if you have something in your hand, whoever amongst you can plant that, even if you know that the day of judgment is upon you, then let them do so. The Prophet ﷺ said, "Badiru bil a'mal as-salihah," rush to do good deeds. Essentially, that every moment of anxiety should cause us to remember death, and every remembrance of death should cause us to do good. And that's sort of the connection between those three at all times. And so from the benefits of good deeds, number one, in al-hasanati yuhibna sayyi'at, what Allah subhanahu wa ta'ala tells us is that good deeds do away with sins. They're a means of expiating our sins. Number two, the Prophet ﷺ mentioned good deeds as a means of having our du'as accepted. Good deeds are a form of tawassul, are a form of intercession for us when we make du'a to Allah subhanahu wa ta'ala, as in the hadith of the Prophet ﷺ, where he mentioned the three men that were in the cave. And as they were stuck in the cave, they all called upon Allah subhanahu wa ta'ala using a good deed that they had committed. And so I know that we're all going to be making du'a, and you'll rightfully be reminded to constantly stay in a state of supplication. Good deeds are a means of having our supplication accepted bi'idhnillahi ta'ala. So trying to do some of those unique good deeds, some of them that were beautifully illustrated by Dr. Mattson about, the maqasid, and then bringing that into play right now with everything that's happening around us, right? Thinking with service, thinking about how we can benefit the environment and people around us, inshallah ta'ala, in these times. The Prophet ﷺ, as he tells us that good deeds are a means of having our dua accepted, the Salaf, the pious predecessors, used to make dua to Allah subhanahu wa ta'ala. نقني من الذنوب والخطايا التي تكبس الدعاء ونقني من الذنوب والخطايا التي تنزل البلاء. That they used to seek refuge in Allah subhanahu wa ta'ala from the sins that cause our supplications to not be answered, and the sins that cause tragedy to rain down upon us. And so the first one is the removal of sin. The second one is the acceptance of supplication. The third one is where the Prophet ﷺ talked about good deeds extending the lifespan. The Prophet ﷺ mentioned that nothing changes a person's qadr, changes a person's divine decree, like doing good deeds. And particularly the Prophet ﷺ mentioned sadaqah, mentioned charity. And I want you to think about how beneficial it is. Alhamdulillah, here we are in these moments. And in the past, when people were quarantined, they didn't have the ability to do sadaqah, right? We can still give sadaqah online, alhamdulillah, and we can still go out and serve our communities, inshallah ta'ala, taking the proper safety protocols with the necessary medical knowledge that we now have. And so Allah subhanahu wa ta'ala has opened those doors of sadaqah for you, and those doors of good deeds for you, inshallah ta'ala. So again, the first one was the removal of sin. The second one was the acceptance of supplication. And now the third one was that it extends the lifespan and wards off the harm that could be decreed for you if a person engages in those. The fourth one is this idea of bringing about happiness in a person's life. The Prophet said, if your good deeds make you happy and your bad deeds make you sad, then that makes you a believer. So it's from a sign of iman, a sign of belief, that a person finds happiness and joy in their good deeds, a great sense of purpose. And so it does ward off anxiety. It does ward off, that sense of paralysis, and it makes you feel useful. And so with those four things, dear brothers and sisters, when we're talking about good deeds, and of course the fifth one, as I mentioned already, was warding off illness, right? And that's something that's implied in the statement of Ibn al-Qayyim rahimahullah, in the general idea of extending a person's lifespan, warding off harm, and the idea of having our du'as accepted. It's all interconnected and giving us a sense of happiness. This last thing that I want to say, inshallah ta'ala, is just like with Ramadan, you sort of set your goals. One of the best ways to work towards something productive is to think about where you want to be at the end of it. Now with Ramadan, obviously it's a stated period. You've got 29 or 30 days, and so you know how much you want to finish in those 29 or 30 days. Allah knows how long we're going to be in this situation. But I want you to ask yourself and to actually write it down, inshallah ta'ala, and say, what do I want to achieve when this is all said and done, right? What do I want to achieve when this is all said and done? What are the habits that I hope I would have picked up? Because, social distancing is a chance to get closer to Allah, right? Social distancing is a chance to get closer to Allah and to close the distance between you and the Creator. What are the tangible things that I want to pick up in this very unique time and make use of those opportunities that the previous speakers so eloquently alluded to? And so note that down, write your goals down. Again, inshallah ta'ala, please do, come and check out what we've put together at Yaqeen Institute. We'll continue to put together content, inshallah ta'ala, and engage the wonderful campaign that CelebrateMercy is doing through Launch Good with Penny Appeal and others. Let's try to think proactively, inshallah ta'ala, about how we can make the most of this. And I pray that Allah subhanahu wa ta'ala allow us to be connected as one ummah by heart in these days, and to be of benefit to humanity, and to be accepted to Allah, acceptable in the sight of Allah subhanahu wa ta'ala in these moments, and to have our good deeds accepted. May Allah azza wa jal enable us to do good in these times. May Allah subhanahu wa ta'ala remove this bala, remove this hardship from our world, protect our brothers and sisters from it. And may Allah subhanahu wa ta'ala allow those who are most vulnerable to be empowered in these moments through the work that we're able to do, inshallah ta'ala, through initiatives like this. So jazakumullahu khairan, wassalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum assalam, and thank you, Imam Omar Suleiman. It's definitely an honor to have you with us. I also do want to mention that Yaqeen Institute for Islamic Research is one of our webinar sponsors today, and they graciously and beautifully had a webinar yesterday as well themselves, and also plugged today's webinar with CelebrateMercy. So we really love collaborating with other organizations, and especially Yaqeen Institute. So we're very grateful to them. If you don't know what Yaqeen is, they are a nonprofit research initiative aimed to address relevant topics head-on with the help of the foremost experts in this space. In addition to translating and analyzing classical works on the subject matter, they also aim to actively participate in the current day discourse, touching on all topics that are related to establishing conviction, yaqeen, in the hearts and minds of Muslims and battling the false notions that underlie Islamophobia and extremism. So please do check them out online, their YouTube channel, their website, the amazing publications that they have, and we're very grateful again, to have Yaqeen Institute as one of our sponsors. We also wanted to mention a couple of other sponsors. One is Khalil Center. And Dr. Rania, actually, I mispronounced Dr. Rania's last name, and I apologize to that too, Dr. Rania. It's not Awaad, it's Awaad. So I hope I got that right. Someone actually texted me and said there's a shadda on the wow. So it's Dr. Awaad. So thank you for correcting me, whoever sent me that text message, mashallah. The Khalil Center is a Zakat Foundation project. It's a community psychological and spiritual wellness center. Khalil Center's approach emphasizes psychological reconstruction, behavioral reformation, and spiritual elevation. Khalil Center utilizes faith-based approaches rooted in Islamic theological concepts while integrating the science of psychology towards addressing social, psychological, communal, and spiritual health. Find out more at Khalil Center. Visit khalilcenter.com. And we mentioned that they are a Zakat Foundation project. So I have to mention Zakat Foundation. Let's see where Zakat Foundation slide is. Give me a second here. I'll have to bring that up later, but I do have a slide for Zakat Foundation as well. But let me mention what they are. Zakat Foundation of America is a US-based Muslim-run charity organization that serves needy communities at home and abroad. They channel the spirit of zakat into a global vision of social development and stand as the foremost authority on interpreting zakat as a factor for positive change. To learn more about Zakat Foundation of America and their other projects, please visit zakat.org, zakat.org. So thank you to all these sponsors. We have a couple of other sponsors we'll mention after our next speaker, inshallah. As you all know, you saw when you entered the webinar, we were asking for donations. This webinar has a cost to us of around $4,000 to $5,000. So some of you donated when you entered the webinar. Some of you may donate when you take the survey. But these sponsors also help us with webinar expenses. So we really do appreciate having these sponsors and other organizations that have helped us to fund today's webinar. And by the way, we organized this webinar within 3 days. As you probably saw the flyer just 3 days ago, the save the date email, we put this all together within 3 days as a response to this pandemic and this crisis that keeps getting worse by the day. So without any further delay, I'll mention Fawakih Institute right after Imam Zaid. We are going to have Subhan introduce Imam Zaid Shakir, and then he will give his talk, followed by a Q&A session, inshallah.
Assalamu alaikum, everyone. So now I'd like to introduce Imam Zaid Shakir. Imam Zaid Shakir has taught courses in Arabic, Islamic spirituality, and contemporary Muslim thought, and Shafi'i fiqh at Zaytuna College, the first accredited Muslim liberal arts in the United States and U.S. history. And he presently teaches Islamic history and politics. He speaks and writes on a wide range of topics and has become a voice of conscience for American Muslims as well as people of other faiths. He is regularly included as one of the Western world's most influential Muslim scholars in the Muslim 500, an annual ranking edited by John Esposito and Ibrahim Khalil. He is also one of the signatories of A Common Word Between Us and You, which is an open letter by Islamic scholars to Christian leaders that calls for peace and mutual understanding. He holds a master's in political science from Rutgers University, and he is one of the 3 co-founders of Zaytuna College and serves on its board of trustees. So without further ado, I'd like to have Imam Zaid Shakir take over.
Bismillahir Rahmanir Rahim. Alhamdulillahi Rabbil Alameen. Wassalatu wassalam ala Sayyidil Mursaleen, Sayyidina Muhammad wa ala alihi wa sahbihi wa sallam tasliman kathira. Assalamu alaikum wa rahmatullahi wa barakatuh. We'd like to thank Celebrate Mercy and all of the organizers of this webinar, all of the co-panelists. I wasn't here from the beginning, so I wouldn't want to mention any names, but may Allah bless them for their efforts, their sacrifices, and the work that they do, not just in the face of this particular crisis, but whenever the Muslims need a clear voice, a clear message, articulate spokesmen and spokeswomen Many of the people involved with this webinar, many of the speakers and presenters are the people that the community looks to. So may Allah bless them and give them all of the good that that could possibly accrue to them in this world and the next. I'd like to start by reiterating what I heard Dr. Rania, dear sister Dr. Rania Awaad, and our dear brother, hardworking brother Omar Suleiman, Sheikh Omar Suleiman, may Allah Ta'ala preserve both of them and all of the others, Dr. Mattson and Abdul El-Sayed and others. Those are the ones I caught. About New Zealand, that this is the day that that gruesome deed that occurred a year ago is commemorated, and may Allah Ta'ala bless all of them, all of those who were afflicted in those tragic events at the two masjids there in Christchurch, New Zealand. May Allah Ta'ala bless them with the highest ranks of Jannah, and may they all be reckoned as being amongst the martyrs, which is a good segue into the coronavirus. We should never forget that those who might perish in this pandemic, that they are also martyrs. الشهداء خمسة المطعون والمبتون والغريق وصاحب الهدم والشهيد في سبيل الله. The martyrs are 5, and there are other categories. One who dies of some epidemic illness, in this case mentioned in the hadith, the plague, one who dies from severe stomach disorder, dysentery, or typhoid, or other things that might occur, for example, in the aftermath of a tsunami when the water systems are knocked out. The gharik, the one who drowns, so the tsunami, people drown. By way of example, sahib al-hadmi, the tsunami, the waves smash up the houses and structures and buildings near the shore, and a lot of people die in those demolished structures. Wa shahidu fi sabilillah, one who dies in the way of Allah. So if the one who was afflicted by a stomach disorder, mabtoon, then one who is afflicted in the lungs, which is the primary cause of death in this case, would certainly be a martyr. One hadith of the Prophet ﷺ really beautifully summarizes the attitude the Muslims should have in this particular instance. So it's related by Abi Hurairah radiallahu anhu, that he said, لا عدوى ولا طيارة ولا هامة ولا سفر وفروا من المجذوم كما تفروا من الأسد. So that there's no infectious disease. In other words, the actual causative agent is the will, the decree, the qudra, the will of Allah subhanahu wa ta'ala, that is the effective cause of the disease, and not what might be the superficial or readily visible cause of the infection. And there's no evil omen. And just to summarize, ولا طيرة ولا هامة ولا سفر, just summarize all three by saying there's no evil omen. There are different nuances, but in the interest of time. But then, and flee from the leper as you would flee from the lion. And so here we see two things operative. Number one, understanding that ultimately everything is caused by the will and decree of Allah, and the believer should understand that. So we shouldn't think that what is meant to afflict us, we're going to escape ultimately, but we shouldn't be obsessed with burning ourselves down with thinking that all of the obvious means are the ultimate cause of things. I say that to say this: we should be praying to Allah first and foremost. We should be praying to Allah subhanahu wa ta'ala. وَإِذَا سَأَلْتَ فَاسْأَلِ اللَّهِ وَإِذَا اسْتَعَنْتَ فَاسْتَعِنْ بِاللَّهِ. If you seek anything, first and foremost, seek it from Allah. And if you ask of anything, first and foremost, ask from Allah. If you seek assistance, first and foremost, seek it from Allah. So our first place of seeking help and seeking relief from this scourge is Allah subhanahu wa ta'ala, first and foremost. And that's all connected with those things from the unseen realm and the realities of that realm as they play out in the world. But then he says, وَفِرُّوا مِنَ الْمَجْذُومِ كَمَا تَفِرُّوا مِنَ الْأَسَدِ. But flee away from the leper as you would flee away from the lion. So there's apparently a contradiction between the first, everything is from Allah, what's decreed is inescapable, and at the end, flee away from the leper. And so the message there is we take every possible worldly means to protect ourselves and to protect others from highly contagious diseases. And so we don't just have a happy-go-lucky, carefree, mashallah, tawakkalna ala Allah approach. We trust in Allah, we put our trust in Allah. The Messenger of Allah said, flee away from a possible source of harm the way you would flee from a lion. And so this is beautiful because we balance between the advice, the counsel that we might receive from our religious scholars in terms of how best to approach this from a spiritual, psychological approach. How can we maintain our sanity? How can we remain calm? How can we continue with our daily activities to the extent advisable? On the other hand, we highly respect and we take the advice of the medical professionals, the public health professionals, by taking every possible means that's recommended for us, because this is taking the means. And so the believer balances between the two. We don't neglect the one at the expense of the others. So we appreciate the contributions of Dr. Nour. We received, I didn't hear on the webinar, but I did receive the nasiha or counsel that she and others have put out there. And so we respect that tremendously. And in respecting that, we take every means to make sure that we're doing everything in our power to protect our lives and the lives of others. And so we closed down the Jummah, we closed down the congregations, because these are measures that will help, in the words of many of the medical professionals, to flatten the curve and to allow our healthcare systems, which could be easily become overwhelmed, even more so than in Italy, which is far less populous than the United States, and their healthcare system, particularly in the northern provinces, have become overwhelmed. And so to flatten the curve and to spread out the spikes and peaks that can occur when we have a disease that no one is immune from, on the other hand, and there's no known effective vaccine or treatment. And so potentially everyone in this country could get it. Everyone in this world could get it, potentially. And so the public health danger should be clear to everyone. And in light of that danger, we take every means. Some people are uneasy with canceling the Jumu'ah, but as I believe Dr. Rania mentioned, there's the hadith of Ibn Abbas, who he ordered his mu'adhin to tell the people, Sallu fi buyutikum, pray in your houses. And the people are uneasy with that. And Ibn Abbas mentioned, radiallahu anhuma, may Allah be pleased with him and his father, that one better than me ordered the people to take a similar measure, referring to the Messenger of Allah sallallahu alaihi wasallam. So as Dr. Rania mentioned, as Sheikh Omar Suleiman and others mentioned, there are religious precedences for the measures that have been recommended by the likes of the ISNA Fit Council and many of our AMJA and others, many of the Fit Councils, many of the learned and scholarly individuals in our community. So we pray that Allah bless everyone. And despair. Prayer, Prophet, and we should pray and every evening, at least times, Allahumma salli wa rasulillah. Bismillahirrahmanirrahim. in the name of with word, and that word is kun. Allah لا يدور معه بسم الله الذي لا يدور معه شيء في الأرض ولا في السماء العليم. The second is kun. So I, in the name of Allah, whose name nothing is harmed, neither in the heavens nor in the earth, and He is the hearing, the knowing. And the second hadith, which I prematurely commented on, اللهم صل على رسول الله أعوذ بكلمات الله التامات من شر ما خلق. أعوذ بكلمات الله التامات من شر ما خلق. I seek refuge with the perfect word of Allah. It's mentioned in the plural, but it's a reference to the singular in another version. بكلمة الله التامة من شر ما خلق, from the evil of what He has created. And that word, perfected word of Allah, is kun, be. And so everything, the coronavirus and everything else in the world only exists with the command of Allah, be. And so we seek refuge with Allah from the evil of what He has created. So may we seek refuge with Allah when may we mention Allah subhanahu wa ta'ala, pray to Allah, turn to Allah during these difficult times, and when may we also heed every bit of advice that the medical and public health professionals offer to us, and combine between these, and inshallah we'll be safe. And those who it might be decreed that they move on, and this is the immediate cause they're moving on, that rest assured that martyrs and continue to pray for good and to be part of, as Dr. Mattson mentioned, a wonderful community response. I think the community has responded very maturely to this situation. So may Allah, all of you, all of our scholars, all of our teachers, all of our organizers, institutions, may they all continue to play a role in that very laudable, the very of our Muslim community. Imam Zaid Shakir, Jazakumullah khairan. Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum assalam wa rahmatullah. Thank you to Imam Zaid Shakir, and for your insights, for your wisdom. Imam Zaid has been my teacher for a long time and someone that I love dearly. Alhamdulillah, Jazakallah khair, Imam Zaid Shakir. Before we move on to the Q&A session, I want to mention two last sponsors, actually one last sponsor. That is Fawakih Institute. And as you know, we don't even know how long many of us are going to be spending more time at home, not able to travel, not able to go to work, some of us, not able to go to public events or crowded events. And for many of us, maybe even not even going to Jummah prayer. There is a beautiful opportunity here while we're home to learn Arabic. And Fawakih Institute is an online institute that allows you to learn Quranic Arabic. They have semesters where you can learn Quranic Arabic with live teachers, live instruction. Their next course begins in June. And they actually have a special deal going on right now. We're also going to send you an email about this, but you may want to note down the link there at the bottom, because if you register before the end of this week for their next semester, you would actually get a $200 discount. This is a weekly class that takes place with qualified teachers. You can see here some of the testimonials from students that have taken their online Arabic classes, including Dalia Mujahid there. So I highly, I have actually attended their online sessions as well. The teachers are amazing. The instruction is amazing. And you can come away, even after learning level 1 Arabic, when you hear the Quran being recited, you can start to grasp many of the words and the meanings of what you're hearing just after finishing level 1 of their Arabic level. So we want to encourage everyone to sign up. Here is a the coupon code is CMercy for Celebrate Mercy. CMercy. 15 people will get a $200 discount if they use that code and sign up for their next semester of Arabic. And this is the slide I was looking for earlier about Zakat Foundation. I've already talked about who Zakat Foundation is, but we're grateful to them also as sponsors of this webinar. So we are now going to go to our question and answer session. We have all of our speakers here for Q&A except Imam Omar Suleiman. He actually texted me that he had an urgent call with the Dallas, Texas County, or the Dallas County government regarding the pandemic, and he's very civically engaged, mashallah, in the Dallas community. So he had to drop off for an urgent call with Dallas County. But we have all of our other teachers here for Q&A, and inshallah, one of our team members, our operations manager, Hasna Al-Ghuzul, will be asking the questions that she has received through the webinar. So I'm going to hand it off to Hasna, inshallah, and I guess we're going to need to turn on all of the webcams and the microphones for our panelists. And inshallah, Hasna, you can take over. I think we're going to be doing this for about 20 minutes of Q&A before we close and inshallah. Great.
Assalamu alaikum. Yeah, I will be turning on the mic for all of our speakers who are still with us. And then I'm going to ask the questions one by one, and please feel free to chime in or take a question and reply. So our first question is going to be more for our doctors. What are some suggestions to enhance one's immunity in this case?
So I'll just jump in. You know, the immune system generally is a function of your overall health. If you exercise and eat well, make sure that you're fortifying your body with micronutrients that it can leverage to empower your immune system. That said, this is a novel virus that humanity has not seen before, as far as we know. And if that's the case, because humanity has not seen it, we're in a situation where your immune system just does not know how to handle it, and that's why it's causing the kind of illness that it's causing. Is that humanity is somewhat immune to this, and so it's spreading like wildfire between us, and people haven't become immune yet. There's also right now it's unclear whether or not, having had the virus infection, you become fully immune. That's usually the case with viral infections, where you become immune to a new virus after you get it, but that's not the case with all viruses, and we're not sure if that's the case with this one. And so the most important thing, again, that people can do is protect themselves from exposure, and protect other people who are more vulnerable as well from that same exposure. But again, also in younger people, it's less likely to cause a very serious infection, though it's far more likely to in older folks. But again, part of the work of public health isn't just protecting yourself, it's protecting the whole community through yourself. And every time one of us does something that is irresponsible and becomes infected, we then become a nidus to infect everybody else. And so one sort of psychological trick that I think is really helpful for folks is, you know, pretend like you have it and that you don't want to spread it to anybody else. That's how you should be behaving. Not just that you're trying to protect yourself, but it's thinking also about protecting everyone else from you spreading it.
Jazakumullah khair for that complete answer. The second question will be for our spiritual leaders. The closing or keeping of the masjid open has become a hot topic. What's the panelist's recommendation in a situation where the community is split into two opposing views? Should the board of directors enforce its view as the authority body of the masjid? Dr. Mattson or Imam Zaid?
Yeah, I'll take that.
Sure.
And give my answer. In general, I mean, the fact that this is happening highlights one of the chronic structural problems in our communities that inshallah you know, maybe having gone through this, maybe we can go back and solve it. It shows how if you have dysfunctions in the system before a crisis happens, it will only get worse. And so what I want to point to is there's a difference between knowledge and knowledge about an issue and about what's permissible can yield conflicting opinions. So we know that there can be ikhtilaf in Islam about different opinions. So knowledge is one thing, authority is something else, executive authority. So every community also needs that executive authority. So in the absence of, you know, in our communities, which are voluntary communities in Canada and the US and the UK, we have to construct our own executive authority because there's not a government or a sultan or imam or someone who can enforce a public policy. So, and throughout Islamic history, ever since the Prophet Muhammad settled in Medina, we have not been without, you know, all different kinds of communities have never been without that executive authority who was able to enforce opinions, a particular position for the public good, no matter how many opinions there were in community. So we need to be able to have that in our communities. We need to have an executive authority made of whatever that executive authority is, whether it's the board of directors or whatever it is, but they really need to understand their fiduciary responsibility to care for the community, to protect the community, and to put in place regulations that everyone will follow. So it is their responsibility. It's not only their, what you could say like right or something like that, but it is the responsibility. And inshallah, if they're unable to do that, then, you know, unfortunately there is some dysfunction. There will be always pushy people who will not accept a decision, but nevertheless, you have to go ahead and do the responsible thing.
I'd like to say something briefly on that. I think we need to educate our communities on some basic principles. I think Dr. Mattson, earlier you were speaking very appropriately about principles. One of the fundamental principles of our religion is that the religion exists at a very basic level to do two things: to secure benefit and to ward off harm. The warding off of harm is given precedence over the securing of benefit. So the people want the masjid open, they want to get the benefit of praying in Jama'ah, the enhanced reward of that, and perhaps other benefits. And the people who are encouraging the masjids to be closed are warding off harm. And so the argument to ward off harm has a priority in this case, especially as I think Dr. El-Sayed alluded to. There's no immunity from this disease. Everyone could potentially get it. And the mortality rate, we need more testing to really determine what it might be. But all of the experts are saying it's upwards to 10 times more lethal than the common flu, which kills tens of thousands of people in this country every year. So I think we have to really emphasize this basic principle. Warding off harm has priority over securing benefit. And so whatever benefit that might accrue to us from praying in congregation, the potential harm is far more severe. And we referenced the hadith of Ibn Abbas. He told the muezzin to announce to the people, pray in your houses, because of a severe rainstorm, and didn't even want them to walk through the mud and the manure in the olden days that was in the pathways. So this is far more dangerous and far more potentially devastating than people getting mud and manure on their bodies and clothing. And so it's even more fitting that people stay home during this couple-week period that's being recommended, or even longer possibly.
Barakallahu fikum. And we do have another question that's health related. What advice would you have for those who work in the healthcare field and are on the front lines?
I mean, I could take that one. Just being safe, hand washing. Your hospital or your public health department or your infection control people should be giving you advice about how to handle this. So if you're at a hospital, and depending on what city you're at, like in Chicago, for example, in the last 24 hours, we've had 30 new cases. So we went from 60 to 90. And so at this point, we're just assuming anybody with a respiratory illness that comes into the hospital is infected with COVID-19, and we're wearing masks and face shields and gloves and gowns for those people. So if you're at an outpatient facility, it's kind of hard to say. There has been, unfortunately, a lack of leadership from the national level on expecting this illness to come to the United States. So a lot of healthcare workers in private settings are having a lot of difficulty in what they're supposed to be doing. But I think if you're in a city where there's community transmission, which is probably many cities now, you need to just assume that anyone that's coming into your office with fever and respiratory illness symptoms is probably infected, and take the proper precautions by wearing the protective equipment that's necessary.
Right, thank you. Thank you very much. We're going to show just a couple of tweets from people who have tweeted for this webinar. And we encourage everybody to do so as well and use the hashtag CoronaCN. So I'm going to share it right now. So this is from Amira Al-Ghabawi. Celebrate Mercy. Really, I appreciate this informative session on COVID-19 response. Key takeaway, our communities must do all they can to support the global response to flattening the curve and supporting low-income families who will be most impacted by the quarantine. CoronaCN. The second one, trust from Ferial. Trust in God, but tie your camel. Dr. Abdul El-Sayed explains that tying our camel right now is practicing social distancing, disinfecting services, and washing hands frequently and thoroughly. CoronaCN webinar. Thank you very much to both of you for tweeting, and then we'll show a couple of more later on, inshallah. And now to another question for our spiritual leaders. And this, is there any possibility of scholars recommending Muslims to not fast during Ramadan, with the logic being needing to drink lots of fluids to boost immune and minimize chances of getting the virus? Imam Zaid Shakir or Dr. Ingrid?
I defer to Dr. Mattson.
Well, this question is based on the assumption that that drinking lots of fluids will boost your immunity. I mean, so I would defer to a health professional on that. Dr. Nour?
I mean, certainly when you get a virus, drinking lots of fluids and sleeping more will help your body fight it off. But I don't know if preventatively drinking lots of fluids is going to prevent you from getting the virus. So the methods we know that's going to prevent you from getting the virus is washing your hands frequently, sanitizing, being aware of when you touch your face, because those are the portals of entry, your eyes, your nose, your mouth, and keeping your distance from people who are actively coughing and sneezing. So those are the ways we know that you're going to try to protect yourself. But I don't think necessarily drinking more is going to protect you unless you actually become infected and have active symptoms, in which case I would recommend as a healthcare professional that you break your fast, you drink more fluids, you sleep longer to help your body fight it off.
Thank you. The next question, it's a little bit long, but it's very helpful. It is very difficult to get tested for COVID-19 in the US right now. Many have the symptoms but are unable to get tested due to many barriers, whether be it cost or availability. If people acquire what they suspect to be a mild form of the virus and are able to recover at home, when is it safe for them to interact with others again? How long will they remain able to infect others? and how long must they quarantine themselves after symptoms begin?
Nour, do you want to take that?
Yeah, sure. Okay, so so for healthcare workers, they're recommending the quarantine to be 14 days. So 14 days from when you get symptoms, when you initially get symptoms. So staying home for 14 days. You know, there's potential that you could continue to shed the virus for longer than that, but that's the average duration, and so that's what we're recommending at this time. So just once you get symptoms, to just stay home and quarantine yourself from other people for 14 days.
The only thing I want to add to that, and Dr. Nour's point was spot on, is that there's an incubation period between when you may be exposed, when you may feel symptoms. And the evidence suggests that you may in fact be shedding virus before you even are facing symptoms. And, you know, I'm just going to say again, this is why it's so critical to protect yourself from being exposed in the first place, because the minute you're exposed and that virus hooks into the cells in your lower lungs, it's going to start replicating. And even if it hasn't hit the degree to which it's giving you now symptoms and it's triggering an immune response, which is what you feel when you feel sick, your body still becomes an itis for it. And so the best defense is to be protected in the first place. And then the other thing that I will say too is that there have been some cases that have been quarantined from that one ocean liner that they quarantined, where there was at least one individual who had been through that 14-day period who is still actively shedding virus. And so even what we think we know is based on a very limited number of cases. And so the biology of the virus itself is just not that well defined. And so, you know, the best thing to do is to prevent exposure in the first place. And even after that, if you think you're infected, being able to get the test and come to medical knowledge is really important, because one of the things that they can do is keep testing you to make sure you're not shedding, although we're limited for the number of tests that we have. And that's a problem at the federal leadership level.
Thank you to both. And staying in that topic, Dr. El-Sayed, there was a question specifically for you. How can we push our local, state, national leaders to close schools, public spaces, cancel events, public gatherings, increase availability of tests, and take other steps that we need to keep the community safe?
Yeah, public officials dealing with an outbreak like this, you have to remember, are just being bombarded and overwhelmed. The most important thing we can do is listen. If they tell us to do something, then we should do it. If they tell us not to do something, we shouldn't do it. The other part of this, though, is you don't have to wait for public officials to tell you to socially distance. And you can just decide that, you know what, I'm going to take responsibility for the institutions that I'm a part of, and make sure that folks know how dangerous this is. You know, and if I'm on the board of a masjid, or I'm on the board of a Muslim private school, or I'm on the board of the Saturday school, then I'm going to push to make sure that we are complying with the spirit of the recommendations that our public officials are making. The other thing I'll say is that, you know, we right now in our country, a bigger picture issue, and I'm not going to talk about the politics of this, although most of you all know what I think. Our response has been too little, too late. There is not the availability of effective tests that we should have been able to deploy at scale. And so it's left us in this scenario where everybody's trying to make decisions on a dime. And so the worst thing that you face in the middle of a public health emergency is inability to communicate effectively, either up or down. And the second is the lack of resources that you need to be able to deploy. And right now, our public officials, particularly at the local and the state level, are facing both of those challenges. And so, you know, the thing I'll say is take the spirit of the precautions that we've been talking about all day today, and take them to your local institutions in which you have power and you have influence. And two, make sure that anything you hear from local public officials, you're then broadcasting through your social media networks, and the people around you know what the recommendations are and how to follow them. And then lastly, take the precautions. You know, all of us are from our tradition, as the Prophet ﷺ says, that all of us are shepherds and everyone is responsible for their herd. And that may be just your own family. And so being able to take precautions with your family and make sure that they both understand what to do and why they're doing it, I think is really critical.
Thanks again. We're going to do two more questions in this session, and I will ask both of them at the same time. We got a lot of questions regarding parents, aging parents who are not listening, who are not taking it very seriously. And part of the question is, how do we convince our parents to take it more seriously, that this is not just a decree from Allah? Some of them think if they are going to get sick, they will, because it's a qadar. So how do we convince them otherwise? And are there any resources in different languages like Urdu or Arabic for our parents who are not very fluent in English? The second question is regarding those who have died from this sickness and they are Muslims. How can we observe janazah? How can we do the ghusl, given all the risks that they are still infectious and the family is quarantined as well?
I'll endeavor to answer the first part. For the second part, I think that is again a medical question, because there are a lot of technicalities in terms of handling the body of an infected person. But my 89-year-old mother-in-law lives with us, and believe me, she's taking it very, very seriously. So I think that there might be some elderly folks out there who aren't, but my experience is that most are taking this very, very seriously, and they realize the potential danger that's out there. Those who aren't, I would just we continue to remind people as gently and as respectfully as possible of the urgency, and make sure that we're doing everything in our power to minimize their exposure to anything that might jeopardize their health.
I can take the part of.
I'd like to answer.
Go ahead, Ingrid.
Okay. I was just going to say about the elderly people, and I've seen the questions. I'm not a psychologist or psychiatrist. Dr. Rania could probably give more nuance about this, but I do engage in pastoral care. And one of the things that we teach in pastoral care and chaplaincy is that often what people, sort of the explanations that people give are often just sort of the superficial presentation of of something else much deeper that's going on. So if you spoke to those elderly people and said, okay, well, if you think it's just about tawakkul, you know, what do you think if I just send my grandkids out to go play with people who have coronavirus? And you're going to see them saying, you know, don't do that, right? So then you're going to realize that it's not really about that they don't believe it's contagious or that you shouldn't take precautions, but there's something else behind it. And I think that for many, it has so much to do with loneliness. And, you know, subhanAllah, maybe, you know, this is one thing we can learn as those of us who are able-bodied and normally able to go out in society every day, to the point where many other people in our community, young people even who are homebound, but also many older people who don't have much social contact. And for them, Jummah or going to the masjid a couple times a day is the only time that they interact with other people, the only time that someone talks to them where they feel they have a sense of purpose. So I think we really need to dig a little deeper into these explanations and realize that all of us have been negligent in taking care of our communal obligation of our fard kifaya, to visit the sick, to be present, to have sohbah for those who are elderly in our community, who are lonely. We know that before this pandemic, that we were told that we have an epidemic of loneliness in our society. So, so I think many people are so afraid of having that last opportunity for engaging with others being cut off. And so we need to address that issue and find ways to be present for other people, especially for those who are normally, in normal times, cut off and isolated.
Thank you, Dr. Mattson. I'm just going to add another couple of things here. And I couldn't agree more. I think so much of what you're saying is so right, and that there is definitely an underlying anxiety, particularly by those who are most impacted, which of course our elders are feeling the brunt of this the most. And so I really do encourage kind of getting trying to get to the bottom of what it is that's causing that kind of pain in them. And sometimes it is the fear of death, which all of us carry, and sometimes it's the loneliness, and sometimes it's also the worry that nobody will actually check up on them. And so in the 5 items I had said before, number 4 was take action and be creative about it, and also being careful not to infect our elders. So we were giving recommendations, for example, grandparents and elders of actually not visiting, especially with younger children or people who may have been carrying the virus, though seemingly healthy. And so we were encouraging things like FaceTiming. And even if these are not biologically related grandparents or elders, to still kind of form a FaceTiming, or kind of like through video conferencing, video messaging, so that they're actually connected. And it would be so creative to be able to do that for all the different members of our community. And that may actually help stem some of the feeling or need of wanting to go out of that isolation, knowing that people are checking on them, people are getting their groceries for them, and certainly kind of quelling that anxiety as much as possible.
Thank you very much to all of our speakers. We still have the question regarding the janazah for someone who had been sick. How should it be handled?
And I could talk to you about the ghusl process. I think the body of the deceased should be handled the same way that we medical professionals decide to interact with people that we are just now assuming all are infected. So that would be to have the people doing the ghusl be gowned, gloved, and have a face mask and shield the eyes during the ghusl process. I think one of the scholars should talk about like the janazah with the Salat al-Jam'ah being canceled or postponed because of the proximity of people. You know, it's going to be a very difficult thing because, you know, obviously the family of the deceased, they want to be consoled and they need to be consoled, and not having a janazah prayer for their loved one is probably very difficult. But I think, I don't know, either Imam Zaid or Ingrid, you guys could talk about like Salat al-Janazah in this circumstance.
I think the best thing to kind of touch all of the bases from the religious and public health angles would be to pray outside at the grave site with a tremendous amount of social distancing. So maybe spacing the believers out, and there's ample room in most cemeteries, maybe 2 arms length from each other, and there's more virtue and more rows, so that could be quite a long row, but making 6, 7, 8 rows that are spaced like that, I think that will probably meet most of the requirements. You're outdoors and you're spaced even more than the distance that's recommended.
Jazakumullah khair to all of our speakers for your input. I will pass the mic now to Tariq Al-Masidi, the founder and director of Celebrate Mercy, for just a quick minute before Imam Zaid closes with a dua, inshallah. Thank you.
Thank you so much to all of our speakers. We really appreciate having you all with us for your insights and for your wisdom. And Dr. Abdul, I also want to just congratulate you as well, because I know that you have recently become a CNN commentator. I don't know if you'll be on tonight after the debate, but it's been great seeing your perspective, and your podcast is amazing as well, America Dissected, inshallah. We encourage everyone to check that out, the America Dissected podcast. So thank you to all our speakers. One thing I want to mention at the very end here, let me share this picture, is next Saturday night is the night of Isra and Mi'raj. It is the night when the Prophet ﷺ made his miraculous journey from Mecca to Jerusalem to Masjid al-Aqsa and then into the heavens. And we all know that story from the Seerah, but that is happening next weekend on Saturday night, inshallah. It's a very blessed night, and we want to encourage everyone to take advantage of the day and the night of Isra and Mi'raj. I think we're all going to be home anyways, given the current situation. But inshallah, we are actually planning as well on Friday evening, the day before or the night before, we're planning a webinar on that topic, reminding our community of the story of the Isra and Mi'raj journey, the year of sadness that the Prophet ﷺ experienced, Ta'if, and the night of Isra and Mi'raj. So it's a day and a night when we can do extra worship, extra dua, extra prayers, and it's a night that we will commemorate on Friday night with a specific webinar about that story and the lessons from that story. So be on the lookout. We'll be sharing some information about that. We've had to readjust. Celebrate Mercy's had to do a lot of readjustment as a result of this pandemic as well. We're going to try to respond by putting out more educational programs, more webinars. We're going to have to shift around our whole fundraising plan that we had for Ramadan, where we usually do traveling iftar dinners. But inshallah, we'll all get through this together as a community. One last thing I'll say is a reminder about our survey. CelebrateMercy.com/survey. CelebrateMercy.com/survey. Let me share that slide with you here. Here we go. Yes, CelebrateMercy.com/survey. This is where you can let us know how you like the webinar. Give us your feedback. You can also make a donation towards the cost of the webinar, but please do take that survey. We're going to be posting the link in the chat room. Without any further delay, I want to thank everyone for joining, all of our teachers, and pass it on to Imam Zaid Shakir for a closing dua, inshallah.
Can I request that Dr. Rania makes the dua?
Absolutely.
So Dr. Rania, please. We haven't heard much from her, and I think so.
Absolutely.
You get the last word, inshallah.
Imam Zaid, it would be so much better if it was you, mashallah.
Yalla, bismillah, tafaddal. Jazakumullah khair.
Rahim. وصلى اللهم على سيدنا محمد وعلى آله وصحبه وسلم أجمعين يا ربي يا كريم. Oh Allah, we ask you, Ya Rabbil Alameen, to shower your mercy down upon us. Ya Kareem, in these days of difficulty, and these days of illness, and these days of fear, and these days of anxiety, we ask you, Ya Rabbil Alameen, to shower your mercy down upon all of us, Ya Kareem. Ya Allah, please quell the anxiety that's in our hearts and the fear that we are carrying. Ya Rabbi, we ask you for shifa, full and complete cure for those who have been afflicted. Ya Rabbi, we ask you, Ya Kareem, to grant everybody who is affected, Ya Kareem, recovery, and those who have passed away, we ask Ya Rabbil Alameen to increase them and to uplift them and to grant them the highest levels of Jannah and to count them amongst the martyrs, Ya Kareem. Ya Allah, Ya Rabbil Alameen, we ask you in these times to keep our feet steadfast on the straight track until the last day. Ya Rabbi, in these days of difficulty, we ask Ya Rabbi to strengthen our iman, our faith in you. Ya Rabbi, to make it clear to us, Ya Rabbi, that you are boss. Ya Kareem, just as you have brought this virus to us, we ask you to bring us through it, Ya Kareem. Ya Rabbi, we ask you that just as we can This virus is a small, little, unseen thing that we cannot, but we feel its sheer effect. We ask Ya Rabbil Alameen to take the bala and difficulty away from all of us across the world, the ummah, and all of humanity. Ya Rabbi, we ask you to turn inward in these times, to really think and contemplate as to why we are here. Ya Rabbi, this tribulation you have sent to us may be a punishment, and we ask Ya Rabbil Alameen to alleviate us from it. We do not know, and only you know, Ya Kareem. Ya Rabbi, we ask you that this tribulation that has affected all of us across the world, Ya Rabbi, that you and only you have the power to lift it up. Ya Rabbi, so lift it from us, Ya Kareem. Ya Rabbil Alameen, we ask you in these days that we are close, we are in the month of Rajab, Ya Kareem, to Ya Rabbi, help us get to Sha'ban and then to Ramadan. Allahumma ballighna Ramadan. And Ya Rabbi, let those days be for us the days of forgiveness and days of mercy, and days of connecting to the Prophet sallallahu alaihi wasallam, and days of connecting to the Quran that we have neglected, and our prayers that we have neglected. Ya Rabbi, let that Quran and our prayers be a source of fortification for us, Ya Kareem. Ya Rabbi, we ask you in these days in which we are worried about connecting with our family members, and Ya Rabbi, them being in close proximity with us in all hours of the day and night, and that's causing us anxiety. We ask Ya Rabbi that actually those hours and those days become healing and blessing for us, Ya Kareem. That the disconnection that we've had with our families and the dysfunction that we have been feeling, let these days actually be a healing for that, Ya Kareem. Ya Rabbi, we ask you to connect us to your Quran and to connect us to your Sunnah and to connect us to the divine wisdom, Ya Kareem, that you hold, that you've taught the Prophet Muhammad sallallahu alaihi wasallam, and by which you have taught us through the Sunnah. Let us uphold that and fulfill that, Ya Kareem. Ya Rabbil Alameen, increase our heart with love of you and with love of the Prophet Muhammad sallallahu alaihi wasallam. Ya Rabbi, make us beloved to you and beloved to him sallallahu alaihi wasallam. Ya Rabbi, let us be people who are actionable, who do upon what they have learned. Ya Rabbi, do not let us be from the hypocrites that learn but do not obey. Ya Rabbil Alameen, let us implement all that we have learned and increase us in knowledge and increase us in goodness and increase us in barakah. Ya Rabbi, increase us in the kind of blessing, Ya Rabbil Alameen, that allows us to get through difficulties like this at a communal level. Ya Rabbi, help us fulfill our obligations, the fara'id for ourselves, but also the communal obligations, the fard kifaya, Ya Rabbi, in helping all of our neighbors and all of our sisters and brothers in faith and all of humanity. Ya Rabbi, let us lift our hands in dua and pray for those who are vulnerable and those who are oppressed and those who are afflicted by disease and those who are afflicted by poverty and by war and by oppression. Ya Rabbi, let us be a reason why they are actually able to get help by our du'as and by our donations and charity and sadaqah and zakah. And Ya Rabbi, by our charity of our time and of our knowledge and our energy and our effort, Ya Kareem. Ya Rabbi, we ask you to be from those, Ya Rabbi, that help spread the knowledge of Islam and the good practices within it, Ya Rabbi, to all of humanity around us. Ya Rabbi, let us be good examples and never a reason why people shun away from this deen, Ya Kareem. Ya Rabbi, we ask you on that last day that we are identified clearly from the ummah of Muhammad sallallahu alaihi wasallam by the nur, the light, our wudu and our prayers. Ya Rabbil Alameen, let that demarcation on our faces and limbs be a reason why we're shaded on the day when none other are shaded. And Ya Rabbi, on that day when you ask us the questions that you surely will ask us, including this particular pandemic, Ya Kareem, we ask that you are pleased and hope that you are pleased with our answers, Ya Kareem. When we stand before you alone and none is with us, we ask Ya Rabbil Alameen that you accept our answers and that we are from people who go straight to Jannah and have nothing to do with the hellfire, Ya Kareem. Let us fly on the Sirat al-Mustaqim straight into Jannah along with our loved ones and our family members and our parents and our teachers. And Ya Rabbi, uplift all of them and grant us the highest levels of Jannah with the Prophet Muhammad sallallahu alayhi wasallam and the Anbiya and the Shuhada. And Ya Rabbi, let us be from those who you accept. And let us be, Ya Rabbi, from those who die on La ilaha illallah Muhammadur Rasulullah. And let the last of our days be the best of them, and the last of our words be the kalima. And Ya Rabbi, we ask you for husn al-khitam, the best of endings, Ya Rabbil Alameen. وصلى اللهم على الهادي محمد وعلى آله وصحبه وسلم أجمعين وعلى نية القبول والهداية والنصر والسلام في كل مكان. Sisters and brothers, for acceptance of this dua, please read with me Surah Al-Fatiha.
Jazakumullah khair to Dr. Rania, to all of our teachers and doctors who joined us. Again, just a reminder to please take the survey, and thank you to the Celebrate Mercy team members, Afifa and Samar, Afifa Khawaja, Samar Malik, Subhan Vahora, Hasna Aguzul. Thank you to our team members who pulled this off within a 3-day period. Jazakumullah khair. We hope that you'll join us Friday night for the webinar on Isra and Mi'raj. And please keep us in your prayers as well. And we pray that Allah gets us through these difficult times, inshallah. Assalamu alaikum.